This medication contains follicle-stimulating hormone, FSH, and is used to treat certain fertility problems in women and men. In women, it helps stimulate healthy ovaries to produce eggs. This medication is usually used in combination with another hormone, hCG, to bring about the growth and release of a mature egg, ovulation. In men, it helps stimulate healthy testes to produce sperm. It is also used in combination with hCG. This medication is not recommended for women whose ovaries no longer make eggs properly, primary ovarian failure, or for men whose testes no longer make sperm properly, primary testicular failure. It's important to follow the dosage and timing as prescribed by your healthcare provider. Follitropin Beta Cartridge can be administered at any time of the day, but it's best to take it at the same time each day to maintain consistent levels in your body. Be sure to discuss any concerns or questions with your doctor to ensure you are using this medication correctly and effectively. Before you start using Follitropin Beta, make sure to read the patient information leaflet provided by your pharmacist. If you have any questions, ask your doctor or pharmacist for guidance. It's important to learn all the preparation and usage instructions from your healthcare professional and the product package. This medication should be used with the prescribed pen device and pen needle. Before using, visually check the product for particles or discoloration. If you see either, do not use the liquid. If the medication is stored in the refrigerator, allow it to warm to room temperature before use. Inject this medication under the skin as directed by your doctor. Before each injection, clean the injection site with rubbing alcohol and change the injection site each time to lessen injury. Use a new pen needle for each injection. The dosage is based on your medical condition, response to treatment, and lab tests. Different Follitropin products are not interchangeable, and the doses may be different. Do not switch to a different brand or type without your doctor's approval. Use this medication exactly as directed by your doctor to get the most benefit from it. Do not increase your dose or use this drug more often or for longer than prescribed. Make sure to learn how to store and discard needles and medical supplies safely. Some common side effects of Follitropin Beta Cartridge include headache, stomach pain, bloating, redness/pain at the injection site, or breast tenderness/pain. If any of these effects persist or worsen, it's important to inform your doctor or pharmacist promptly. It's important to note that this medication has been prescribed to you because your doctor has determined that the benefits outweigh the risks of potential side effects. Many people who use this medication do not experience serious side effects. However, it's crucial to notify your doctor immediately if you experience any serious side effects, such as flu-like symptoms, bleeding from the vagina, or swelling of ankles/hands/feet. Additionally, seek medical help right away if you experience very serious side effects, including shortness of breath, chest/jaw/left arm pain, sudden dizziness/fainting, or sudden severe headache. It's also important to be aware that Follitropin Beta Cartridge may cause a condition known as ovarian hyperstimulation syndrome, OHSS, which can lead to severe pain or swelling in the lower abdominal area, severe nausea/vomiting, or sudden/rapid weight gain. If you experience these symptoms, seek medical help immediately. While a serious allergic reaction to this drug is rare, if you notice any symptoms of a serious allergic reaction, such as rash, itching/swelling, severe dizziness, or trouble breathing, it's important to seek medical help right away. This is not a complete list of possible side effects, so if you notice any other effects not listed here, be sure to contact your doctor or pharmacist. Before using Follitropin Beta Cartridge, make sure to let your doctor or pharmacist know if you are allergic to it or any other products containing follicle-stimulating hormone, FSH, streptomycin, or neomycin. This medication may also contain inactive ingredients that can cause allergic reactions, so it's important to discuss any allergies with your pharmacist. Before starting this medication, it's important to inform your doctor or pharmacist about your medical history, especially if you have had abnormal bleeding from the vagina or uterus, thyroid problems, adrenal gland problems, cancer of the reproductive organs, tumors in the brain, ovarian cysts or enlargement, fertility problems, blood clots, stroke, heart diseases, lung problems, or if you are using any other prescription drugs, non-prescription drugs, or herbal products. It's also important to note that using Follitropin Beta Cartridge may result in multiple births, so it's crucial to consult your doctor for more details. If you become pregnant while using this medication, stop using it immediately as it must not be used during pregnancy. And if you suspect that you may be pregnant, be sure to inform your doctor right away. Additionally, it is not known if this drug passes into breast milk, so it's important to consult your doctor before breastfeeding. When it comes to the daily dosage and optimal timing, your doctor will provide you with specific instructions based on your individual needs. Be sure to follow their guidance closely for the best results. When using Follitropin Beta Cartridge, it's important to be aware of any potential drug interactions that could affect how it works or increase your risk for serious side effects. Make sure to inform your doctor and pharmacist about all the products you use, including prescription/non-prescription drugs and herbal products. It's crucial not to start, stop, or change the dosage of any medicines without your doctor's approval. One product that may interact with Follitropin Beta Cartridge is gonadorelin. It's important to discuss with your healthcare provider if you are using this product to ensure it does not interfere with the effectiveness of Follitropin Beta Cartridge. Always follow your doctor's instructions and recommendations when using this medication. If you or someone else has taken too much Follitropin Beta Cartridge and is experiencing severe symptoms like fainting or difficulty breathing, it's important to seek immediate medical attention. In the U.S., you can call your local poison control center at 1-800-222-1222, and in Canada, you can call a provincial poison control center. It's important to act quickly in these situations to ensure the best possible outcome. It's important not to share this medication with others. While using Follitropin Beta Cartridge, you may need to undergo lab and/or medical tests such as vaginal ultrasound, hormone levels, and semen tests. It's important to keep all medical and lab appointments and consult your doctor for more details. If you happen to miss a dose of Follitropin Beta Cartridge, it's important to consult with your doctor or pharmacist to establish a new dosing schedule. It's crucial not to double the dose in an attempt to catch up. After using the Follitropin Beta Cartridge, you can store the unused cartridge in the refrigerator or at room temperature for up to 3 months. Once used, you can keep the product in the refrigerator or at room temperature, but make sure to throw away the used cartridge after 28 days. Remember not to freeze the cartridge and to protect it from light. Also, avoid storing it in the bathroom and keep it away from children and pets. Make sure to properly discard the product and it is expired or no longer needed, and consult your pharmacist or local waste disposal company for proper disposal instructions. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.